Chapter 3, Cultural Consideration. Of course, we do now the outline only. Okay, let's go to my next. Here we have the summary of the chapter, and through the chapter I divide, and also the book divides in 7 categories, and each of them they have subcategories. Mostly on the 7, it's more on here. It's longer, this section. So now we go to the next. Introduction. Every clinical decision is filtered through culture, yours and the patient's. Culture means steps, raise, readmissions, and malpractice risk. Culturally attenuated care improves satisfaction and adherence. And it's a little bit more in the introduction, but this is my main key. And the second, ethnicity, race, identity, culture, and cultural belief system. It's on the keywords. And now we go a little bit more about it. Culture, shared values, beliefs, norms, and practices, learned and transmitted across generation. Ethnicity, a group shared a cultural heritage or national origin. On my keywords, I talked about Latins, and I have here another one, H-Mong. The race, U.S. Census Bureau's 5 social categories talks about the white, black, African American, American Indian, Alaska Native, Asia, Native Hawaiian, Pacific, Islander, and those are social, not biologic labels. The identity, it's how individuals define themselves. Like many include intersecting faith, such as gender, identity, religion, or profession. Then we have the cultural belief system, is the stories, rituals, and rules that explain illness, healing, family roles, time, and death. Here we have a cultural focus. Ask open-ended question like, what do you think caused your illness? To elicit those beliefs instead of assuming. Assuming it's really very common with communication between nurses. It's a lot of assuming, and I've been seeing this. Now we go to the next. 3. Cultural competence, humility, awareness, and sensitivity. Here again, we have those keywords. So please look up on the keywords from previous video. So let's go again to cultural. Here I made it all together. In the keywords, they are alphabetically. Here just all together. Cultural awareness is like knowing your own bias and how culture shapes perception. So the key nursing action is complete a self-reflection checklist before each clinical rotation. 2. Cultural sensitivity is showing respect for values and practices different from your own. The key nursing action is adapt meal times, for instance, for Ramadan or prayer breaks. 3. Cultural competence is the ongoing ability to provide effective care across cultures. The key nursing action is, for the cultural competence, use certified interpreters, tailored teaching to health literacy level, document cultural preferences. The last one, cultural humility, is a lifelong process of self-critique, learning, and seeing power imbalance. So the key nursing action is like ask, what else should I know to take the best care of you after every assessment. Then we have number 4, health disparities and creating health equity. Again, it's in the keywords, and they explain about NAA's nursing scope of standard of practice and has 6 standards. Then we have about the ages, so it's the keyword, the definition comes here, the race, the gender, the sex, LGBTQIA, economics, language and literacy, the demographic, the geography. And the last one is the bias, when the bias and discrimination, implicit bias, conscious bias, explicit bias, bias in healthcare professional, misgendering, stigmatizing, xenophobia. So all this is from the keywords I explained earlier in the video. So nurses learn to use self-reflection tools to surface hidden assumptions before they shape care. 5. Eliminating disparities and creating health equity. Here we have 2 subdivisions, the social determinants of health, SDOH. So the SDOH model has 5 elements: economic stability, education, social and community context, health and healthcare, neighborhood and built environment. Also now, because we are in 2025, they have Healthy People Initiative of 2030, but later gonna be probably 2040, like in the future. So it's always they update few keys, not much, but they update every 10 years few points. Then we have the 2, improving health literacy. During discharge, nurses provide teaching regarding their new medical condition, right? Use plain language, teach back, pictograms and bilingual discharge folders. Every time, for instance, if they come and now they have uncontrolled diabetics, then you kind of need to print out education about the diabetics. And they have also pictures and how they need to use it, because some people they don't know. It's just they don't know. Assess patient needs with limited ability to speak, write, or read English. Implement class standard, provide language services, easy to understand, signage and communication partnership, interprofessional and community outreach, mobile clinics, peer navigators, and community health workers to bridge trust gaps. The next one is the 6 cultural assessment modules, and here they come. They explain more about the transcultural nursing. They will talk more about transcultural nursing by Madeline Leninger. So it's the sunrise model. So she has here, it's a nice picture. So Leninger's culture, care, diversity, and universality theory. So basically we'll explain more about that. It's nice. It's going to be in mostly in the quizzes, but they don't say Leninger maybe, but they say her theory itself. So be aware of that. Number 7, here is a kind of longer slides. It's a lot to explain on here on 7. Assessing cultural competence, again, the cultural. The characteristics, they go communication, assessment and strategies, space, personal space or boundaries, time orientation. Social organization includes the family unit, environmental control. They have 3 major concepts: biological variation. Then we'll go and sub categories like characteristics to observe, communication tips, and cultural phenomena, and sample of nursing strategies. So we go to characteristics to observe. It's more about willingness to adapt routines, like for instance, flexible visiting hours for extended family, consistent use of patient choosing names or pronouns, proactive requests for interpreter services, not patient initiated. Here I had a patient came to visit children in United States. So they are from China, and they had an accident, and we had to use interpreter. Even that the son, the daughter could speak, we had to use interpreter. And hospitals now, they have those walking iPads, and you just you need to, when you use interpreter, you need to use the ID, the time when you start, and you have to explain when you document what was the reasons and what was during that, like medication teaching procedure, patient education regarding something. So it's very important to use interpreter, and it takes a little bit longer, but it's very useful. Communication tips. Use the teach back method for every discharge instruction. Before you discharge a patient, you need to make sure they know how to take their, let's say, acute check for diabetics. They know what wound care if they have a home health. Like, they have to kind of talk you back what is going to happen tomorrow, kind of to give you the picture how they do it tomorrow, for instance. Speak in short sentences. 5th grade reading level is like very simple, like me, I do very short sentences. Face the patient, do eye contact, and even if they sit in the chair, take a chair, kind of be like same level. If they're laying in bed and kind of you need to kind of lower a little bit, or maybe it's better for them to kind of sit up. You can elevate the head of bed, and you kind of, it's close to the eye contact. It's very important to have face to face. Avoid talking through an interpreter phone without context. Cultural phenomena and example of nurse strategies. The book give like very nice examples, so that you can read. Continue for the this phenomenon, like how you say the space, an example. In the book is a little bit different. This is mine a little bit different. How close is comfortable when we speak, and then the nurse will position yourself at preferred distance as per permission before touch. Then the time orientation is like, is being early or on time important in your family? So that means schedule medication, reminders that respect polychronic versus monochronic orientation. Now the social organization is like, who helps you make health decisions? So that includes elderlies or spokesperson in care conferences. The environmental control is like, do you use herbs or ritual to stay well? And if yes, you need to document and check for drug herb interaction, which we know there are some. Then the last one is the biologic variations. Ask any family history of shingles cell disease. This is just an example, but can be any other thing. This was my example. Then this is that the nurse use evidence-based guidelines for genetic risk screening. And the key points of this chapter is like how you apply culture in nursing process. At PI, assessment is the language decision makers, healing practices. The diagnostics is the readiness for enhanced health literacy. Planning or implementation, partner with community resources. Then evaluation, use patient defined success markers. The legal and ethical mandate, it's the Joint Commission's requirements and a Code of Ethics, Title 6, language access. Non-compliance can cause accreditation and federal funds. Always is like those legal and ethical mandates, and they have examples in the book more. They talk more in detail, but just this is the key points outline from the chapter 3, and I will add the PDF with the outline on the description below, and you can just print it just to kind of have an overview what is talking about, and you can write next to the page, on the page, like some other keynotes that you might need to remember from this. And thank you, and end of chapter.